Hey guys, welcome to Dogshala. So in our NEET series, NEET MDS 2023 recall series, so we are going to see today about post-operative hemorrhage. So what is post-operative hemorrhage? What is hemorrhage? What it is? So hemorrhage, as we all know, it is nothing but bleeding. Bleeding post-operatively. Why do we see post-operative bleeding? There are causes for post-operative bleeding and how we can manage the post-operative bleeding. Let's just see in this video how it is, and we will also solve a question from previous exam. So before going to that, just like our video and do subscribe to our channel if you have not subscribed yet. So let's just dive into this topic now. So, post-operative hemorrhage. So, what is post-operative hemorrhage? As you all know, it is a complication that occurs after the surgery, any surgical procedure. So, it is classified mainly into three categories: primary, reactive, and secondary hemorrhage. The post-operative hemorrhage is of three types: primary hemorrhage, secondary hemorrhage, and reactive hemorrhage. So, let's just see what these are. Classification. So, the primary hemorrhage. Primary hemorrhage is the bleeding that occurs during the intraoperative period. Intraoperative period is nothing but during the procedure. So it should be resolved during the operation only, with any major hemorrhages recorded in the operative notes, and patient should be monitored closely post-operatively. So during surgery, if there is profuse bleeding, it should be resolved during the operation itself. So this is known as primary hemorrhage. Then reactive hemorrhage. So reactive hemorrhage occurs within 24 hours of operation. So within 24 hours of the surgical operation, if a bleeding is occurring in the patient from the surgical site, then it is known as reactive hemorrhage. So it may be mostly due to the ligature that slips or a missed vessel which we have not ligated. So these vessels can often be missed intraoperatively due to intraoperative hypotension and vasoconstriction, meaning only once the blood pressure normalizes postoperatively will this bleeding up. Okay, then coming to secondary hemorrhage. Secondary hemorrhage occurs 7 to 10 days post-operatively. Secondary hemorrhage is the bleeding which is occurring in the patient after 7 to 10 days of the surgery. It might be due to the erosion of a vessel from a spreading infection, such as heavily contaminated wound is wound is closed primarily. When heavily contaminated wound is closed improperly, if the infection is still there inside the wound, then it leads to secondary hemorrhage as it causes the erosion of the adjacent blood vessel. Okay, so these are the types of hemorrhage and when and where they occur in the surgical site. The clinical features of these is the patient experiences tachycardia, dizziness, agitation, raised respiratory rate, and a decreased urine output. Okay, so these are all the things. Since there is loss of volume of blood, most of the clinical features are equal to the clinical features which we see in hemorrhagic shock. Okay, so any external bleeding from a wound or drain will also be evident. Swelling, discoloration, disproportionate tenderness, and any peritonitism in, especially when we are in abdominal cases, is evident. So the observations should be reviewed and assess the degree of shock. Since there is loss of blood volume, we need to assess the degree of shock that the patient is going post-operatively to manage the situation. So let's just see with the classification how it is done. So the classification of hemorrhagic shock, as you know, they are classified into 4 classes. Okay, the classification is 4 classes depending on the loss of blood volume. Okay, coming to class 1. Class 1, less than 15% loss of blood volume, heart rate is 60 to 100, blood pressure is normal, and mental status is slightly anxious. So fluid required, crystalloid fluid resuscitation is enough. Class 2, 15 to 30% of blood volume is lost, and 101 to 120 heart rate will be, and blood pressure is normal and mildly anxious, and crystalloids are enough. Then Class 3, 31 to 40% of blood volume is lost. 121 to 140 will be the heart rate, and there is a decreased blood pressure. And the patient, you can see him as an anxious and a confused person. Then crystalloid and blood products will be required to resuscitate the patient. Then class 4, more than 40% of blood is lost and heart rate is more than 140 and BP is decreased in confused and lethargic patient. And here also we have to manage it with crystalloid and blood products. Okay, so this is the classification of hemorrhagic shock. You have to remember the entire table. So you can just take a screenshot of this table and remember it. Okay, then coming to the management. So if there is a clinical suspicion of post-operative bleeding, fast and efficient initial management will reduce overall morbidity and mortality of the patient. An A to E approach is followed. What is A to E? Airway. First of all, check airway. Then breathing of the patient, circulation of the patient should be checked, disability should be checked, and exposure. So this is what is advised. First, check all these, then assess the degree of shock that the patient is going on. Then go to the adequate intravenous access and rapid fluid resuscitation to resuscitate the patient. So when you have a visible bleeding site, apply direct pressure to the bleeding site to stop the bleeding. Then urgent blood transfusion should be considered in case of moderate to severe post-operative hemorrhages. If severe bleeding, so this should be in the form of, if severe bleeding is see, we have to resuscitate the patient with RBC, platelets, fresh frozen plasma, and with a major hemorrhage protocol needs to be activated. Then it may be appropriate to reoperate. So if the hemorrhage is not getting controlled properly, the hemostasis is not occurring in the patient, it may be advised to reoperate in the surgical site with further evaluation. So conservative management of smaller hemorrhages is indicated, but close monitoring should always be taken. Okay. So this is the management of hemorrhagic shock. The question which was asked in the previous exam was a case-based question. So let's just see the question. A patient was operated for thyroidectomy, that is near the thyroid gland. Parameters were normal on monitoring. On the same day around evening, patient developed pain, swelling around the neck. On exploration of surgical site, bouts of clots were found. Bouts of clots were found. There is pain, there is swelling. That means there is hemorrhage occurring in the surgical site. So what kind of hemorrhage we can say this is? Since it has occurred post-operatively within the evening, that is within 24 hours, we can conclude it as a reactive hemorrhage. Okay. So if you like our video, do subscribe to our YouTube channel. Do like, share our video to your friends and colleagues. And you can also follow us on our Instagram handles at Docshala and Docshala Medical. And you can also find us on Telegram. Thank you.